Jennifer and I'm a dentist at Sparkle Dental. I'm here today to talk to you about tooth discoloration. There are so many different causes of tooth discoloration, but if we split them into two main categories, then it might be a bit easier to talk about. So these two categories are external factors and internal factors that influence tooth discoloration. External factors that influence tooth discoloration are when staining occurs on the outer layer of the tooth. Now, the first cause of this would be food and drinks. Particular foods that can stain your teeth include coffee, tea, red wines, curries, certain fruits and vegetables as well. The second factor would be smoking or use of tobacco. Smoking can also increase the risk of decaying gum disease. And the third thing would be poor dental hygiene. So that means inadequate brushing and flossing to remove food and stains can also cause tooth discoloration. Internal factors that affect tooth discoloration are when the inner layer of the tooth darkens. There are several oral conditions such as tooth decay and gum disease where the teeth may change colour. Certain dental materials, such as amalgam restorations, also known as metal fillings, can cast a grey-based colour underlying a tooth. If a tooth has had trauma to it in the past, then over time, that tooth may start to become a yellow to black colour as the nerve inside it starts to die. For instance, a fall when a child is young may damage the developing permanent tooth, or even direct trauma to a permanent tooth can also cause a tooth to discolour. Sometimes if a child has a certain sickness or has been taking a particular type of antibiotic during the development of their teeth, then the teeth formed may be a much darker colour. If you've noticed white patches along some of the teeth, this is called Theosis, and this can be due to excessive use of fluoride at a young age as the teeth are developing. Genetics-wise, some people tend to be more prone to lighter or darker teeth depending on the thickness of their enamel. With age, the outer white layer of tooth called the enamel gets thinner and wears away, revealing an underlying yellowish shade of tooth called the dentine. Most of the external staining on teeth can be removed by good oral hygiene and regular professional cleaning. In-office professional tooth whitening and take-home tooth whitening can also be done to whiten teeth. Other treatments to change a tooth colour can vary from fillings, root canal treatment to veneers and crowns. The most important thing to establish is the cause of the staining. Once this is determined, then we can work towards fixing it. So come in for a checkup today and we can find out why your teeth are discoloured and discuss the different options available to you.